#1 news station. News Radio 950 WWJ.
It is more good news about drug giants Pfizer's COVID vaccine. We'll have the latest. Also, another installment of Ask the Doctor. Coming up, we will be talking live with Dr. Robert Klever, Chief of Emergency Medicine at DMC Detroit Receiving Hospital. And lots of businesses scaling back because of the coronavirus, but not the local turkey farm. WWJ's John Hewitt will join us live and local with this story. Good afternoon. I'm Brooke Allen for WWJ News Radio 950. Also coming up this half hour, sports.
Will the number 7 turn out to be a lucky one for the Pistons in tonight's NBA draft? That story and more coming up in sports.
Slight gains on the market today. We'll check your money coming up at 12:55. WWJ News Time, 12:31. More good news about drug giant Pfizer's COVID vaccine. CBS's Elaine Cobb reports.
Pfizer says final results from trials show its vaccine is 95% effective against the coronavirus. The company plans to apply for authorization for emergency use in the U.S. within days, but it will likely be months before it's available to the public. Developed with German partner BioNTech, the vaccine was effective in all ages and ethnicities, and there were no major side effects. The one disadvantage is it needs to be stored and transported at ultra-cold temperatures. Elaine Cobb, CBS News.
While we continue to see a spike in COVID-19, each weekday at 12:30, we are going to be answering your questions about the coronavirus. And joining us on the live line today is Dr. Robert Klever, Chief of Emergency Medicine at DMC Detroit Receiving Hospital. And Doctor, thank you so much for joining us. What's the situation at the hospitals right now?
Well, the situation is that obviously, if you've been following the news at all, that COVID cases have been increasing. So we're just seeing more and more cases. But we've had 8 months to figure out how to deal with it. So I think we're doing a great job with it right now.
And we are hearing about what seems to be pretty positive news on vaccines. The latest, we just heard about that report from Elaine Cobb. What do you make of it?
I think the vaccine news is very promising. I think, the CDC and the FDA obviously will do their due diligence and make sure that it's safe and effective and healthy for everyone. As you mentioned previously, there's going to be a little bit of issues with transportation and cold storage, so you're probably going to have a little bit less limited places to get it. But I'm very excited to get it myself and hopefully start moving past this as not only a state and the country and the world and get back to what our new normal will be.
What are you hearing from patients that do have the coronavirus? Are they saying that they will take a vaccine, or will it not matter since they've already had it?
I haven't asked that directly to very many patients. My role as a ER doctor is to make sure that we diagnose the people safely and accurately with the coronavirus. And we have rolled out a new test that we get our results back within 39 minutes with the accurate PCR test, and to make sure that we diagnose those patients safely and keep them separated from the rest of the patient population, which we have been doing a great job with, and really thank our nurses, especially in the emergency department, who take on the brunt of that burden, and our environmental services or janitorial services that make sure the rest of the place stays clean.
We are also hearing about an at-home COVID test today. Do you think that will be helpful or confusing?
I think it will be helpful to the people that do it right. It is quite uncomfortable. I've been tested myself about a dozen times. So you want to make sure that you do it right, and it's a little bit frustrating to get that swab all the way back to the back of your nose, and it can be a little bit uncomfortable at times. So I think for the people that certainly end up testing positive, obviously that will be a good, accurate result, but people need to make sure they do it right and get it back there, which, like I said, can be uncomfortable.
So Thanksgiving, obviously, next week. Are you concerned about more spikes after the holidays?
I am concerned with the spikes, and it's sad. Thanksgiving's probably my favorite holiday of the year, and we decided with both my wife's family and my family that we're going to put Thanksgiving on hold this year. The turkey will taste the same, but the pumpkin pie probably won't be as sweet without the family around.
So do you think that people should stay home in general?
I think it's the safest thing to do. It's just hopefully with the vaccine fronts that are coming out, both with Pfizer and Moderna, this will be the last holiday season with it. And we've all missed and we've all had to sacrifice. But it comes down to what's it worth. And to me and my family, it's not worth the chance, even if it's 1 in 1,000, that, my mother or father or my in-laws get it and they pass away. from it. So it's just not worth it. And I know that a lot of people haven't seen people pass away from it, but it is real and it's heartbreaking when patients are alone and they're with you. And you try to do what you can and treat them like family members, and hold their hand when they're there, but it's not worth it to me. There'll be another Thanksgiving in 2021 and there'll be another Christmas, and just because you can't be with your family physically doesn't mean that you care any more or less about them.
So I have to ask, how are the nurses and the staff and even yourself holding up?
I think it's varying degrees. I think everybody has done a remarkable job, and what I tell my staff and my nurses and even my friends and family, it's okay to feel how you're feeling. It's okay to be frustrated with this. It's okay to be disappointed. It's okay to be sad. But, if you need to talk to somebody and need help with that, reach out. There's plenty of support systems out there. We have a crisis center and emergency department if you feel like you need to talk to a psychiatrist. But it's okay to feel how you're feeling, but we need to make sure that your safety is paramount. And we've worked very hard for the last 8 months as a society to make sure that this is good. So please, the end is near. Just be diligent. The flu pandemic of 1918 lasted 3 years, and we're not going to be that long.
You mentioned earlier when we first started speaking that you had learned a lot in the ER when this first began. So tell us, what did you learn earlier this year that is helping you now?
So probably the best analogy is the novel coronavirus is what they called it. Nobody really knew how to take care of or treat it, so it's trying to figure out how to fly a plane and assemble it at the same time. And now that we know how to treat it and we have good medications, we have good regimens, and we're able to figure out, hey, hydroxychloroquine is not safe. It's actually probably harmful to give the patients. We know how to treat it, and we have well-defined algorithms and treatment pathways that work for everybody, which is why you saw a pretty precipitous drop in the death rate from people that have coronavirus. So we're much better at treating the patients, identifying the patients that need hospitalization, and identifying those patients at the hospital that need escalating levels of care.
Okay, thank you so much. Again, we have been speaking to Dr. Robert Klever, Chief of Emergency Medicine at DMC Detroit Receiving Hospital, for our Ask the Doctor segment, which happens every day at 12:30. Coming up next, Thanksgiving almost here. WWJ's John Hewitt will join us live and local with a look at